So behind me is a circle that represents 10 million children, just like the ones you saw in the video. And in 2000, when Melinda and I started the foundation, that's how many kids under 5 were dying every year. 1 every 3 seconds. And this statistic was so stunning to us that it became the top priority of our foundation to work with others to change that number. And the world did act. Gavi was created, Global Fund was created, new vaccines were made cheaper, vaccine coverage was increased. And for malaria, we created new bed nets and got those out. And so the tools really made a phenomenal difference. Childhood death fell by over 50%. And so now we're down at 4.6 million, which I think is always worth celebrating. A lot of people aren't aware of it. It's one of humanity's greatest achievements this century. And yet, it's hard to celebrate a 50% improvement when you're still talking about millions of childhood death. Every life matters. Every death is a tragedy. And so there's been a quest to find out why are those children dying and how do we prevent it. Just looking at the age of death is a very striking thing. Of under 5 deaths, half who die before they're 1 month old. 75% of those are in that first week, and 2/3 of those are on the very first day. And so when we talk about childhood death, these early deaths are a significant part of that burden. And in fact, this is the part that we knew the least about. We figured out with pneumonia and malaria and diarrhea, which are the 3 biggest killers after the first 30 days, we figured out, okay, what were the interventions there. But for the first 30 days, we knew so little. We knew there was infection or asphyxia, but that didn't tell us what had to be done. So large investments were made, investments to understand the microbiome or what exactly infection was taking place. So over this last decade, we now know a lot more. We know more, we've learned more in the last 10 years than we've learned in the last century. So it's armed with this knowledge that we go forward. One of the key studies that's unlocked that knowledge, funded by the foundation, is called CHAMPS. That stands for Child Health and Mortality Prevention Surveillance. Early in the life of the foundation, when we were talking about deaths, I said, well, don't they do autopsies for kids? And people looked at me like I was crazy because the cost and expertise and, you disfigure the body. And so, that simply, there was nothing like that. But CHAMPS was designed to work everywhere in developing countries. The expertise involved makes it a little bit like a TV show, House or CSI, where you do medical investigation. You gather data, you look at that data, and think about what it says. So whenever you have a child dying in these regions, the developing countries where we're running CHAMPS, the researcher goes to the parents and asks for permission to examine the body and take gut samples, lung samples, and brain samples so that all the information is gathered up and goes back to a panel of doctors. And those doctors look at this in great detail, trying to understand exactly what caused the death, but also the full picture of what led up to that situation. And this information was very surprising. For example, we had thought that whooping cough, a particular disease, would be a killer of over 10%, and it was only 1%. We thought that a particular type of pneumonia, although we knew it was there, Klebsiella, we thought that would be very small. And yet it emerged as the single largest cause of these neonate deaths. And so that really drove us, okay, we need to get new antibiotics out. We need to use new ways. We need to look at trying to do a vaccine exactly for that. The thing that was very rich in the CHAMPS data was not just that ultimate cause of death, but the whole chain of events. And for almost every child, there are multiple factors. Why was the child so weak that infection drove them over the edge? And that's why we can think about it a little bit like CSI. When you die of pneumonia, you work backwards and say, okay, was that pneumonia only there in that hospital setting? Or were they susceptible to it because of malnourishment? And so, going back in time, we can look at all the things that we could have done differently. And the one that emerged, perhaps not surprisingly, again and again, is malnutrition. At the very, very beginning, even during pregnancy, some kids are on their growth path, and some kids get off that growth path, even in utero, and also during their first few days. In fact, almost half of all the children who die are malnourished, and so they're overrepresented by a factor of 4 in the kids that don't make it. So it's a very depressing finding. We think, oh my goodness, we're not even at that early stage of life doing the right things for the nourishment. But that led to a lot of new insights. Study on inflammation and the placenta and all sorts of things that you can do to help the mother, help the child, even at birth, achieve their normal nutrition. So here over the next hour, it's going to be upbeat. You're going to see these new ideas, actually 7 different areas, ranging from AI-enabled ultrasound, which helps us figure out which pregnancies are high risk, to technologies that can help a premature baby, breathe, which is the greatest risk for them in terms of dying, to micronutrient and arm supplements that help the mother help the baby and improve pregnancy outcomes. I love the work we do in global health. I love the great innovators we get to back. And I'd say, I've gotten over the decades to see a lot of amazing breakthroughs. But I really rank this collection of tools that I think we can get out, ranked near the very top when you look at the number of lives that can be saved. How many lives? If we deploy them, it's over 1,000 lives every day. And so that's 2 million lives by 2030. And that's not the only metric that captures how important these things are. Because we're helping with the nutrition, we're helping the baby get on their growth path, even for the vast majority that survive, they'll be far better off. In fact, they'll thrive because the probiotic or micronutrient supplement, all these things we now understand quite well, improves their gut health, improves their nutrition, and even if they're exposed to a disease, they'll be far more likely to survive and do well. We see this, we look at various measurements of brain development. We can see that these interventions are causing better brain connection, more white matter. We can see it in their physical development. So we've learned a lot. We continue this research path that's very, very exciting. I want to close on opening story. Hopefully I can tell this. So in order to see the CHAMPS work, it actually got started in Soweto, in a hospital there. And so the idea is I went in and, a child had died that day, not surprisingly because there's deaths most days. And so I went in and saw the baby's body. At first, it was wrapped in plastic, and the doctors came in and unwrapped it, and they took these samples. You know, they do it in a way that does the least disfiguration possible. In fact, it's very clever how that design has been done. But the thing that we're never sure about as we were pulling all this together is, would a parent give permission? I mean, after all, it's, you know, the worst day of their life, and you're explaining what you're going to do, including gathering these samples. And so, in fact, you know, that the mother of that baby had chosen to volunteer. And she was there at the hospital, so after I'd been in to see the doctors, I went out to see her, and I said, why did you agree to participate? And she gave a very straightforward answer, which is, I just don't want this to happen to another family. And you know, that's an act of kindness at a very tough time. And so, in the spirit of what that mom agreed to do, I think all the rest of us should say, okay, you know, we should make the effort as well. We should take this knowledge, we should take these very low-cost tools and do our best to get them out there into the world, so even in those fragile times during pregnancy and the first few weeks, that more kids survive and grow up to live healthy, productive lives.